On Maddie's 20th birthday, she was scrolling through an online boutique when an ad about self-breast examinations popped up. This sparked her interest and led her to want to give herself one because she was nearing the age where breast cancer is most likely to occur.
Wait, something doesn't feel right. I think I need to call my mom. Hey Mom, I gave myself a breast cancer examination because I saw an ad online. I don't want you to be alarmed, but I found a lump that doesn't feel like the rest of my breast tissue.
Oh dear, I was worried this would happen, but I didn't think you'd be at risk of having breast cancer, especially not at this age. Let's schedule an appointment for a mammogram.
Hi, I'm Dr. Dolly, and I'm a radiologist. I see Maddie has an appointment with me today. What brings you ladies in today?
I'm Maddie, and this is my mom, Amy. I gave myself a breast cancer examination, and I think I found something alarming. I found a hard lump in my left breast that doesn't feel like the other tissue.
That is alarming, but not uncommon. You did the right thing by coming in early, because that is when we are able to get tumors and lumps under control before they turn into a bigger problem. Do you have any family history of breast cancer that you know of?
That you ask, I think we do. My mom and her mom before that, and her mom before that, had some type of breast cancer. Being as I don't have breast cancer, I just assumed that there would be no chance for Maddie to have it, and I just didn't think it would affect Maddie this young, since she's so young and healthy.
Well, breast cancer cannot really be predicted, being as it can happen to anyone, but having a history of breast cancer can increase your chances of having it too. Okay, well, let me do a little examination. Where did you find this lump?
It's on the side of my left breast. It's actually very hard, so I'm not really sure how I didn't notice it sooner.
Yes, I see exactly what you're talking about. We need to do a mammogram and get a better picture of the lump. And we may need to do a biopsy. I'll put an order in for a genetic test right now as well. A mammogram is an x-ray of the breast that is used to detect early signs of breast cancer. The mammogram will be done by having you stand in front of the x-ray machine, and the technician will position you on the bottom plate, while the top plate will come down from above to flatten the breast in order to get a good picture. Maddie, if you're ready, I'll show you the way to the x-ray room.
Doctor and Maddie exit the office and go to the mammogram room where the doctor will be able to get a better understanding of what is going on with the lump of tissue in her left breast. A mammogram has two panels that go on the top and the bottom of the breast and are able to send an x-ray to the radiologist, who then inspects the image for signs of breast cancer. The radiologist then dictates what they see on the x-rays and sends it off, and depending on the facility, the results are ready within a few weeks. However, if there is a concern with the mammogram, results will be given earlier. There is no need to be scared should you have an abnormal mammogram, as the diagnosis is not always cancer. In Maddie's case, a tumor was found and a biopsy was done to examine the breast tissue closely.
Being as this is a special case where the mammogram was done out of concern and not just a regular checkup, I reviewed the x-rays as well as the genetic tests. On the mammogram, I noted an area of high density which appears white on the x-rays. This is normally an indication of a lump or a tumor, as Maddie has expected. The results of the various tests that were completed give me more information on the type of breast cancer that Maddie has. The type of breast cancer is commonly genetic.
So, Dr. Dolly, what exactly causes this kind of breast cancer?
In Maddie's case, this type of breast cancer is caused by the interaction between the mutated BRCA1, BRCA2, and PALB2 genes. I ordered a genetic test while her tissue was being sampled, which confirmed the presence of this mutation. While BRCA1 and BRCA2 are involved with repairing DNA in the cell before it divides, and PALB2 stabilizes those genes while their proteins are working on repairing the DNA. Zhang says that BRCA1 and BRCA2 are tumor suppressor genes, which have roles in DNA damage response, and PALB2 is the mediator between the interactions with BRCA1 and BRCA2. In Maddie's case, her PALB2 gene is mutated, which means that its protein cannot bind to BRCA1, which causes the DNA to be unrepaired and allows for uncontrolled cell division. And thus, a tumor has formed. When the PALB2 gene is mutated, there is a 35% chance of breast cancer developing in women by the age of 70. It's excellent that Maddie chose to examine herself when she did. Breast cancer typically presents itself around her age, and I see that today is her 20th birthday. Since you have a family history of breast cancer, I thought it would be a good idea to do a genetic test to confirm the presence of these genes. Statistically, 1 in 400 people carry the mutated BRCA genes, and if your mother is diagnosed with breast cancer, you have a 50% chance of inheriting those genes.
Oh no. If only I knew that mutated genes were inherited, I would have informed Maddie of this earlier.
Right. And now, gene profiling tests can determine treatment options. If the chances of cancer returning are high, then chemotherapy is an option. But if the chances of cancer returning are low, then hormone therapy is a better option.
Thank you so much for everything. All of this information has really opened my eyes to the science behind breast cancer, which can be inherited.
Some heavy topics were covered within this video, including our 3 main points: how the mutated interaction between BRCA1, BRCA2, and PLB2 can be an indicator of breast cancer. Genetic tests can be completed to see if an individual with a familial history of breast cancer carries a mutated gene, and the importance of self-examinations. To stress the importance of breast cancer self-examinations, I will now give you the steps from the Breast Cancer Organization to follow in order to perform it properly. First, look in the mirror with your arms on your hips. You should be looking for bulging skin, dimples, redness, or soreness. Then you should raise your arms and look for the same indicators. There should not be any fluid coming out of the nipples. After that, you should lay down and examine both of your whole breasts using a smooth and firm touch. Lastly, examine one more time standing up, and you can even do this in the shower. You should perform these tests once a month. Anyone can get breast cancer, so don't be like Amy and believe that it will not happen to you. It is better to diagnose it sooner rather than later because your treatment options can change. For instance, if the cancer is not likely to return, the hormone therapy can be done. But if the cancer is likely to return, the chemotherapy is the only treatment option. This topic is significant and worthwhile to research because the interactions between the genes that we presented are not well known in regards to our intended audience. We want to raise awareness of the possibility that genes that are passed down in families can be mutated and increase one's chance of becoming cancer positive. It is scientifically relevant because genetic testing can be done to determine if one has mutated genes. This is Team Pink Genes, and we hope you learned something new today. Thanks for watching.